In hotter countries, concrete or porcelain tiles are often used, unlike carpet in colder countries. So it's important to consider the various aspects of this, because they can be a slipping hazard, a tripping hazard and a slipping hazard for elderly people with dementia, these tiles, if they get wet and slippery especially. So they need to be dried off sufficiently, and making sure that the actual path that has been mopped is dry before dementia residents venture forth onto it. Maybe the mopping can be done at night when they're asleep. That would be a good way around it. Now, the dementia resident also needs to have good supportive shoes with a supportive grip underneath the shoes, not slippery sandals. Check that out, because it's very important that the shoes do have that good grip underneath the sole, underneath the shoe, so that it has that friction that with the floor surface when they walk along. You can check this out either by putting on the shoes yourself if they fit and go for a walk and make sure there's that traction with the floor, or otherwise get the shoe and slip it along the surface of the floor and make sure that it's not slippery, that it does grip. Because even if your parent has been wearing sandals all their life and managing well in a familiar environment, it may be that in an unfamiliar environment where they're disorientated and there's not the orientation as at home, they can much more likely slip and fall, and good shoes go a long way to helping this. If the person has always been used to wearing sandals, it's hot, they like wearing sandals, that's fine. But make sure the sandals are supportive all round, around the ankle as well, that they're not too floppy. But the main thing is underneath, that they've got that good supportive grip. Now, in terms of the pathways followed in a dementia unit and floors and shoes, the main pathways, of course, will be from the dementia resident's room to the lounge, typically because they need to go back to their room to go for toileting if they've got an ensuite, which hopefully they have. Otherwise, the general toilets, they'll need to go back and forth from there. So direction orientation is needed. Firstly, for the room, let's start with that. We've gone through that a bit before, but the door identification is pivotal, with their name and the number clearly on the door. Now, it may be also helpful to put up a recognisable photo on the door, again at eye level, either of the family or maybe a religious symbol. It might be Buddha or a Hindu god or goddess that they're, that's important for them, Ganesh or Lakshmi, or it could be a slogan from Allah, maybe they've had at home, a recognisable slogan that they like. And if they have that on their bedroom door, they're much more likely to be able to find it when they go along the corridor, orientating themselves. It is very difficult for dementia residents to find their own room in dementia facilities. They've got memory loss, direction orientation loss, and a good 60% find it difficult to find their room. So all these positive practical techniques to help them find their room go a long way. Now, in terms of orientation, another aspect that helps is making use of those wonderful long corridor walls. Walls, again, play a big part in being able to help orientation for dementia residents. So it's such a good space to make use of. Really, either putting up scenery of your own scenery in your own country, famous tourist spots, or photos of farming, or photos of, the city life. Commonly held pictures and photos of your country that people in the dementia facility will have seen before and know well. It could be a mosque, could be a church, it could be a Buddhist shrine, the Golden Temple. Put these lovely pictures around the hallway, and that will really, really help these people because they spend a lot of time in the corridors. It can often take 5-10 minutes to get from their room to the lounge if they're a slow walker, which most or many of them are, and then they can spend an hour and a half a day in the hallway, especially if they stop and chat to their neighbour, and sometimes in front of a lovely picture they can discuss and talk about because it's recognisable to them. So in that way, it makes for a much more harmonious, enjoyable time for the dementia residents, a more inspirational time. They need inspiration, they need motivation, and their religious gods and goddesses and idols and, their faith, pictures of their faith on the walls will help stabilize them because they need so much reassurance. How confusing is it to be taken from your own home to another facility at an elderly age with dementia? So if they have these pictures on the wall of their favourite deity, of their favourite god or goddess, of their faith, in the way that they're used to connecting with, not a picture that they've never seen before, but commonly known pictures or similar to, in lovely big frames in the hallway that they can view and just stand and look at. It's peaceful for them, it's quiet, because corridors are quiet generally in dementia units, much more quiet than the main lounge and the kitchen and the nurse's station, which is often a racket. Multiple noise going on there, and it can be difficult to think and hard to relax. But if the person goes along the corridor and sees their favourite picture of Buddha, for example, on the wall, they can just stand there for a minute or two in quietness, and it can give them, hope and restore their shattered feelings and reduce their anxiety. As well, if they have these pictures in their room, of course it helps, or even if there is a quiet place at the dementia unit, a little room with a few seats with the common pictures of their faith, of the country, in the room, in a nice spot with a nice chair, just so they can sit quietly and have some respite and time out. Actually, the relatives as well, they often get exhausted with the whole dementia story, and they will appreciate being sitting there often with their family member as well. So it can be a place of quietness and solace at some place in the dementia unit where it's more quiet. And in that way, the challenging behaviour of dementia residents can settle because they're receiving that calmness. I mean, we can't access peace of mind unless it's a calm environment. And we need calmness with dementia, especially when there's so much going on that people have to deal with within their psychology and mind. So a quiet space, either making that lovely, nice, quiet space in their room or in a quiet place in the facility. And sometimes in the room too, it's nice to have some relaxation music or some nice religious music that they're used to on a cassette recorder or in some way that they can listen to it. Cell phones are too difficult for dementia residents really, but maybe a transistor radio or a cassette recorder or some technology you can set up so that the person can listen to the music quietly in the day and enjoy it in their own space and place. So these are the ways to be able to help. So I've written these books on these topics, Residents' Voice and Residents' Rise, both from a dementia unit. They're pitched, I admit, from the perspective of New Zealand and colder climates because that's where I've been used to working. I have actually travelled a lot around Asia and across land to Europe, but only as a tourist, not living there in these hotter places. But so I'm doing my best here to garner points for you. But you will be able to pick up on the themes and adjust it to your situation, whether your parent is at a dementia unit or living at home. These principles, many or most of these principles, apply to a home setting or a dementia unit setting. So thank you for your looks and likes and comments. I appreciate it. And please pass on the links and please subscribe. And thank you to those of you that have subscribed. Thank you.